My name is Brooke Guyon, and in this video I will be demonstrating inserting an indwelling catheter. So first you will want to gather your supplies, which are the insertion kit, an extra pair of sterile gloves, a catheter leg strap or tape, a bath blanket for the patient to be covered with while the procedure is going on, a flashlight or procedure lamp, an extra sterile catheter in the same size in case something goes wrong. So, to begin, you want to enter the room, provide privacy, and identify the patient, introduce yourself, explain the procedure that will be happening, and get their permission. So, after that, and they agree to it, you provide perinatal care if needed, and then you position the patient. So for a female, you will want her legs flexed and the feet as far apart as possible. In the male, you will want it the same way or lying supine with his legs together. So to begin, you would open the catheter tray and put it in the correct place, which is a sterile field. And the way you would open it, you will open the flap away from you, the two sides, and then the one closest towards you. So after that, once you set up the field, you don your sterile gloves and then you prepare your sterile supplies. So next you drape the patient and then lubricate the first several inches of the catheter. Then you clean the urinary meatus however it would need. For the female, it would be the far side, then the near side, and then you would go front to back over the meatus. And then for the male, it would be the glans penis in a circular motion from the meatus outward and down the shaft. For the female, to start the procedure, for the female, while holding the labia open with your non-dominant hand, you would insert the catheter into the urethra about 2 to 3 inches. And then for the male, while holding the penis at a 90-degree angle, you will insert the catheter into the urethra about 7 to 9 inches. And until the urine flows out, then you will go another 1 to 2 inches to make sure it's in there good enough. So after that, you take the sterile syringe and you inflate the balloon and ensure that it is inserted properly, and then you can give it a little tug to make sure it's in there. So after that, you secure the catheter tube to the inner thigh with enough give to the tube, that way it doesn't irritate at the urethra and whenever the patient moves. And you want to secure that with either a catheter strap that wraps around the thigh or tape. So after that, you hang the drainage bag on a non-movable part of a bed to prevent it from being raised above bladder level. So after that, your procedure is done, so you clean up your supplies, doff your gloves, and perform hand hygiene. So after that, you ensure the patient is comfortable, cover them back up, put the call light in reach, and tidy up their area as they need. So once that is done, you document the procedure and how the patient responded to it.